41. A 12-month-old should be able to say 2 to 3 words. True or false? Answer: true. Rationale: by 12 months, infants typically say 2 to 3 meaningful words, reflecting language development per infant developmental milestones. 42. Honey is safe for infants under 12 months. True or false? Answer: false. Rationale: honey can cause infant botulism in those under 12 months due to immature gut flora, per Pediatric Nutrition Safety Guidelines. 43. The HIV vaccine prevents Haemophilus influenza type B infections. True or false? Answer: true. Rationale: the HIV vaccine protects against Haemophilus influenza type B, which can cause meningitis, administered starting at 2 months, per CDC schedules. 44. A pulse oximetry reading of 90% is normal for a healthy child. True or false? Answer: false. Rationale: a normal pulse oximetry reading for a healthy child is 95–100%. 90% indicates hypoxemia, requiring assessment, per pediatric vital sign norms. 45. Distraction is an effective pain management strategy for preschoolers. True or false? Answer: true. Rationale: distraction, such as storytelling or toys, reduces pain perception in preschoolers by engaging their attention, per Pediatric Pain Management Guidelines. 46. Childproofing is unnecessary for homes with adolescents. True or false? Answer: false. Rationale: childproofing, e.g., securing medications, firearms, remains important for adolescents to prevent accidents or misuse, per Pediatric Safety Guidelines. 47. The Moro reflex should persist in a 6-month-old infant. True or false? Answer: false. Rationale: the Moro reflex, a startle response, typically disappears by 3 to 6 months, with persistence indicating neurological issues, per neonatal developmental milestones. 48. Adolescents require parental consent for all medical treatments. True or false? Answer: false. Rationale: adolescents can consent to certain treatments, e.g., mental health, reproductive care, in many states, depending on laws, per legal standards. 49. Oral rehydration solution is used to treat dehydration in children. True or false? Answer: true. Rationale: oral rehydration solution restores fluids and electrolytes in children with dehydration, especially from gastroenteritis, per Pediatric Treatment Guidelines. 50. Nurses should use adult pain scales for school-age children. True or false? Answer: false. Rationale: school-age children use age-appropriate pain scales, e.g., Wong-Baker faces, to accurately report pain, per Pediatric Pain Assessment Guidelines. 51. A 5-year-old should be able to tie their shoelaces independently. True or false? Answer: true. Rationale: by age 5, children typically develop the fine motor skills to tie shoelaces, reflecting developmental milestones for school-age children, per pediatric growth standards. 52. Fruit juice is recommended as the primary hydration source for infants. True or false? Answer: false. Rationale: infants should primarily receive breast milk or formula for hydration. Fruit juice is not recommended before 12 months due to high sugar content, per American Academy of Pediatrics Guidelines. 53. The pneumococcal conjugate vaccine, PCV13, is given to prevent bacterial meningitis. True or false? Answer: true. Rationale: PCV13 protects against Streptococcus pneumoniae, a common cause of bacterial meningitis, administered starting at 2 months, per CDC immunization schedules. 54. A normal heart rate for a 10-year-old is 120 to 140 beats per minute. True or false? Answer: false. Rationale: a 10-year-old's normal heart rate is 70 to 110 beats per minute at rest, lower than younger children due to maturing cardiovascular systems, per pediatric vital sign norms. 55. Parents should be taught to check water temperature before bathing a child. True or false? Answer: true. Rationale: checking water temperature prevents burns, a key safety measure for children with sensitive skin, per Pediatric Injury Prevention Guidelines. 56. the APGAR score is assessed at 10 and 15 minutes after birth. True or false? Answer: false. Rationale: the APGAR score is assessed at 1 and 5 minutes after birth, with additional scoring only if needed per neonatal assessment protocols. 57. Adolescents should be assessed for risky behaviors during well-child visits. True or false? Answer: true. Rationale: screening for risky behaviors, e.g., substance use, unsafe sex, during adolescent visits promotes health and early intervention, per American Academy of Pediatrics guidelines. 58. Antibiotics are the first-line treatment for viral infections in children. True or false? Answer: false. Rationale: viral infections, like most colds, are self-limiting and do not require antibiotics, which treat bacterial infections, per pediatric treatment guidelines. 59. The FLAC pain scale is appropriate for assessing pain in school-age children. True or false? Answer: true. Rationale: the FLAC scale is used for nonverbal or preverbal children, including some school-age children unable to self-report, per pediatric pain assessment guidelines. 60. Nurses can administer non-emergency medications without verifying a child's identity. True or false? Answer: false. Rationale: verifying a child's identity using two identifiers ensures medication safety, preventing errors, per pediatric medication administration standards. 61. A 2-year-old should be able to use two-word phrases. True or false? Answer: true. Rationale: by age 2, toddlers typically use two-word phrases, reflecting language development, per toddler developmental milestones. 62. Solid foods should be introduced to infants at 2 months of age. True or false? Answer: false. Rationale: solid foods are introduced at 6 months when infants have adequate head control and digestive maturity, per pediatric nutrition guidelines. 63. The rotavirus vaccine prevents severe diarrheal disease in infants. True or false? Answer: true. Rationale: the rotavirus vaccine, given at 2 and 4 months, protects against severe rotavirus-induced diarrhea, per CDC immunization schedules. 64. A respiratory rate of 30 breaths per minute is normal for a sleeping neonate. True or false? Answer: true. Rationale: a neonate's normal respiratory rate is 30 to 60 breaths per minute at rest, including during sleep, per pediatric vital sign norms. 65. Family-centered care includes addressing parental concerns about treatment plans. True or false? Answer: true. Rationale: addressing parental concerns fosters trust and collaboration, a core component of family-centered care, per pediatric nursing principles. 66. Safety gates are unnecessary for homes with preschoolers. True or false? Answer: false. Rationale: safety gates prevent falls on stairs for preschoolers who are mobile but lack full coordination, per pediatric safety guidelines. 67. The palmar grasp reflex disappears by 3 months of age. True or false? Answer: true. Rationale: the palmar grasp reflex typically fades by 2 to 3 months as voluntary grasping develops, per neonatal developmental milestones. 68. Adolescents require the same immunization schedule as younger children. True or false? Answer: false. Rationale: adolescents receive specific vaccines, e.g., HPV, meningococcal, tailored to their age and risk factors, differing from younger children per CDC schedules. 69. Morphine is commonly used for mild pain in children. True or false? Answer: false. Rationale: morphine is reserved for moderate to severe pain. Mild pain is managed with acetaminophen or ibuprofen, per pediatric pain management guidelines. 70. Nurses must obtain parental consent for all adolescent mental health treatments. True or false? Answer: false. Rationale: adolescents can consent to mental health treatments in many states without parental consent, depending on local laws, per legal standards. 71. A 4-year-old should be able to hop on one foot. True or false? Answer: true. Rationale: By age 4, children typically can hop on one foot, reflecting gross motor development per preschool developmental milestones. 72. Skim milk is recommended for toddlers under 2 years. True or false? Answer: false. Rationale: whole milk is recommended for toddlers under 2 to provide essential fats for brain development, per pediatric nutrition guidelines. 73. The meningococcal vaccine is recommended for adolescents. True or false? Answer: true. Rationale: the meningococcal vaccine is given at 11 to 12 years to protect against meningococcal disease, per CDC immunization schedules. 74. A blood pressure of 140/90 mmHg is normal for a 12-year-old. True or false? Answer: false. Rationale: a 12-year-old's normal blood pressure is approximately 120/60. 80 mmHg. 140/90 mmHg indicates hypertension, per pediatric vital sign norms. 75. Therapeutic communication with children includes using age-appropriate language. True or false? Answer: true. Rationale: age-appropriate language ensures children understand and feel comfortable, enhancing communication, per pediatric nursing principles. 76. Electrical outlets do not need covers in homes with school-age children. True or false? Answer: false. Rationale: outlet covers prevent electrical injuries in school-age children who may still explore unsafely, per pediatric safety guidelines. 77. Neonates should be placed on their stomachs to sleep. True or false? Answer: false. Rationale: neonates should sleep on their backs to reduce the risk of sudden infant death syndrome, SIDS, per American Academy of Pediatrics guidelines. 78. Adolescents should receive the HPV vaccine to prevent cervical cancer. True or false? Answer: true. Rationale: the HPV vaccine, given at 11 to 12 years, prevents human papillomavirus infections linked to cervical and other cancers, per CDC recommendations. 79. Weight-based dosing is required for all pediatric medications. True or false? Answer: true. Rationale: weight-based dosing ensures safe and effective medication administration in children, accounting for body size, per pediatric pharmacology principles. 80. Nurses can ignore parental refusals of life-saving treatment for a child. True or false? Answer: false. Rationale: parental refusals of life-saving treatment may require legal intervention, e.g., court orders, but nurses cannot ignore them without due process, per ethical standards.